Hello everyone. So today we are going to see about the patient safety indicators topic, which is falling under the infection control and patient safety. So in this we are going to see about the surgical safety checklist for the patient, why it is important and how it can be utilized for the vulnerable patients and all the patients at the inpatient department. This is a sample of what is patient surgical safety checklist in order to enhance the safety of the patient. So in this checklist, which is being done by the World Health Organization, it is universally accepted, and in all over the worldwide we are applying this patient safety surgical checklist. So in this we'll be planning in for sign in, time out and sign out. In sign in we'll be seeing detail one by one what are the things to be assessed. In time out what are the things to be done, and as well as in sign out. So the main purposes of surgery safety checklist is that to avoid surgery of wrong patient at wrong site, to improve the communication consistency, and the care must be throughout the patient stay, to avoid complications and avoidable death associated with surgery, to avoid adverse legal issues. So these are the major purposes for conducting a surgical safety checklist. So what is the role of the surgical safety checklist is that to save, we can give safe delivery of anesthesia, prophylaxis against infection, effective teamwork and other essentials. So how it can be used, how it is to be used is that it is used in three critical junctures, that is sign in, time out and sign out. In sign in, we are going to do that assessment before anesthesia is being administered to the patient, before the patient is given the anesthesia drugs, that is before he is going to unconscious state, and when he is very well sound and aware of the surrounding. Time out is being performed immediately before the skin incision, and sign out is done by the anesthetist, the nurse, the surgeon and the team before the patient is taken out of the operating room. So when this sign in is being done, so sign in is done before the induction of anesthesia, as we already saw. In this we are going to analyze the patient identity, the site, procedure and consent. Here we are also going to check whether the anesthesia machine is in proper working condition, whether the medications which is planned for the patient's weight and age of the patient is kept ready at the in the induction bay. Then also we have to check whether the pulse oximeter is working and it is being attached to the patient, and whether the patient is known to have any allergy. If he is known to have any allergy, so that should be immediately taken into consideration what was the drug he is allergic, and the whole team must be aware that he is allergic to particular drug. For example, they are allergic to propofol or any other sort of antibiotics. So that should be read little louder before we start the procedure. And whether the patient is prone risk for developing more than 500 ml of blood loss in case of a children 7 ml per kg blood loss. So we have to prepare the patient prior with bleeding donors, fresh donor, and then we can plan it for the procedure. In time out, this is done before the skin incision. Confirm all the team members by name and role. Confirm the patient's name, procedure and where the incision will be made. And then whether the antibiotic has been given within the last 60 minutes. We have to cross check and counter check. Anticipated critical events should be discussed by the surgeon, anesthetist and the nursing team. And if there is, like for example, if the patient is planned for CABG. So if the CD, that is angioplasty CD, is being placed, or any other images, if it is CT, MRI or any nuclear medicine scan being done, whether it is placed on the imaging area, that is also to be checked. Then in sign out we are going to check in for before, like after the patient is being done with all the procedures. So this is done by the nurse and the anesthetist and the surgeon. So the nurse will be confirming verbally the name of the procedure, the completion of the instruments, that is the counts. How many instruments have been taken, for example, the artery forceps, retractors and so on. And the sponge count. So it can be the sponge count like a Gamgee pad or might be the gauze pads. And then the needle counts. Then the specimen labeling must be done very clearly and loudly, including the patient name should be read loudly if any specimen is taken for sample, and whether if the equipment problem to be addressed, that also to be done, and if there is any key concerns of recovery and management of the patient. The aim of this WHO safety checklist is that the patient will be operated correctly as well as at correct site. The team will also use preventing very harm to the patient, like using the anesthetics very liberally to the patient in case of pain. And the team also will be able to recognize and prepare for life-threatening losses or any airway management we can plan in adversively. And the team also will recognize and effectively prepare for risk of high blood losses. And also we can plan in for reservation of blood units. The team will also avoid induction of allergic or adverse drug reactions for which the patient is known to be significant risk. And the other five major aim is that the team will be using the methods to minimize the risk of surgical site infection, as well as we can also plan in for how many sponges or instruments being used before and after the procedure, thereby preventing unnecessary sponge being packed into the patient's abdomen or any other surgical site. The team will also be very secure and adequately identify all the surgical specimens, whether it has been properly marked and sent to the lab, and also the team will be able to know they'll be able to communicate very effectively, and they'll be able to have a safe conduction of operations. The hospital and the public health system will establish routine surveillance of surgical capacity, warning and risks. So that's all for today. Thank you all. Don't forget to comment, like and share. If you have any doubts, please put onto the comment box. Thank you.